NCLEX RN Guide 2026 questions to help you stay fully prepared. Question 1. A 43-year-old African American male is admitted with sickle cell anemia. Which of the following outcome criteria would the nurse use to assess circulation in the lower extremities? Option A. Body temperature of 99 degrees Fahrenheit or less. Option B. Toes moved in active range of motion. Option C. Sensation reported when soles of feet are touched. Option D. Capillary refill of 3 seconds. The correct answer is option D. Capillary refill of 3 seconds. Capillary refill is a direct assessment of peripheral tissue perfusion. In sickle cell anemia, vaso-occlusive crises can impair circulation, making refill time a critical metric. Question 2. A 30-year-old male is brought to the emergency department in sickle cell crisis. What is the best position for this client? Option A. Side lying with knees flexed. Option B. Knee chest. Option C. High fallers with knees flexed. Option D is semi-fallers with legs extended on the bed. The correct answer is option D. Semi-fallers with legs extended on the bed. Flexing the knees or hips during a sickle cell crisis can further impede already compromised blood flow. Keeping the legs extended helps maximize circulation. Question 3. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of the highest priority? Option A. Taking hourly blood pressures with mechanical cuff. Option B. Encouraging fluid intake of at least 200 ml per hour. Option C. Position in high fallers with knee gauge raised. Option D. Administering Tylenol as ordered. The correct answer is option B. Encouraging fluid intake of at least 200 ml per hour. Hydration is the primary intervention for sickle cell crisis to reduce blood viscosity and prevent further sickling of red blood cells. Question 4. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat to assist with recovery? Option A. Peaches. Option B. Cottage cheese. Option C. Popsicle. Option D. Lima beans. The correct answer is option C. Popsicle. Popsicles provide both comfort and much-needed hydration, which is essential for a patient in a vaso-occlusive crisis. Question 5. A client is complaining of severe pain in his feet and hands during a sickle cell crisis. The pulse oximetry is 92. Which intervention would be implemented first? Option A. Adjust the room temperature. Option B. Give a bolus of 4 fluids. Option C. Start O2. Option D. Administer meperidine, Demerol, 75 mg for push. The correct answer is option C. Start O2. Oxygenation is the priority, ABC, when the pulse oximeter shows hypoxia, 92%, and the patient is experiencing sickling, which is triggered by low oxygen. Question 6. The nurse is instructing a client with iron deficiency anemia on dietary choices. Which meal plan would the nurse expect the client to select? Option A. Roast beef, gelatin salad, green beans, and peach pie. Option B. Chicken salad sandwich, coleslaw, French fries, ice cream. Option C. Egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Option D. Pork chop, creamed potatoes, corn, and coconut cake. The correct answer is option A. Roast beef, gelatin salad, green beans, and peach pie. Roast beef is a high source of heme iron, which is absorbed more efficiently by the body than non-heme sources. Question 7. The nurse is recommending activities for a client with sickle cell anemia to avoid hypoxia. Which activity is most appropriate? Option A. A family vacation in the Rocky Mountains. Option B. Chaperoning the local boys club on a snowskiing trip. Option C. A traveling by airplane for business trips. Option D. A bus trip to the Museum of Natural History. The correct answer is option D. A bus trip to the Museum of Natural History. High altitudes, mountains/plains, and extreme cold, skiing, can trigger a crisis. A low altitude, indoor bus trip is the safest choice. Question 8. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which of the following would the nurse include in the physical assessment? Option A. Palpate the spleen. Option B. Take the blood pressure. Option C. Examine the feet for petechiae. Option D. Examine the tongue. The correct answer is option D. Examine the tongue. Vitamin B12 deficiency, pernicious anemia, is often characterized by a smooth, beefy red tongue, known as glossitis.